reasons why it's not gonna heal?
Complications. What are the complications? We have an infection, right? We got an infection to a wound. What happened to the wound?
When you're not doing
Sometimes you're not too.
What possible can happen to the wound?
Sometimes it's drain, sometimes it smells.
Make it dressing for all the time.
What?
You're not making, you're not
Cover dressing. Sometimes it's
dressing
Cold wind chair?
for one.
yeah, probably
drainage,
What you guys are giving me is new things leading up to. What we're saying is a complication. And one of the things that we talked about, infection because of the skin is the largest what? Organ in the body, and it's the one is made function is protection. Right?
Yes.
And we know that if a defense is broken, we have lots of bacterial runners. On your hands right now, on the laptops you have, on the chairs you sit on, have lots of bacteria. But these bacteria can't do anything because the skin is irritated. Protect them, right, from getting into your body. But when the body gets broken, like a wound, now they become invaders.
They
Now get into the body. And when they get into the body, now you get a what?
Affection.
An infection. Right? But normally they're around you and there's nothing going on. So now you got this infection going on. What would be the complication of this infection?
Caesar?
That's fine. Remember the complications, for instance. Remember we talked about the dehiscence? Dehiscence is when you have an infection of a suture line, and the suture's what? Open.
Evisceration?
And when it happens, the dehiscence happens, it opens up. That's a complication.
Evisceration?
Dehiscence is a complication. Evisceration is a condom. You have some dehiscence with evisceration, right? But those are the complications. Not just it being infected. Once you have any type of break in the continuity of the skin, you will get an infection. If you don't take care of it early. So they mention different type of things. They talk about high velocity, which is like bullets. They talk about if you get stung by a bee, right? Bitten by an insect. But remember, the insect, when they bite you, like a mosquito, they all want to get something to eat. They need nourishment. They don't come there to infect you with Zika virus or West Nile virus or anything. They just want to get there, so it's blood, so they can survive. But unfortunately, when they burn you, what's in their body? Not what's in your body. They don't intentionally put it into your body. It's just that it's in your body, and when they burn you, it comes out. And when it comes out, it now replicates in your body, and you get an infection. And then we went on to talk about the pus. And the pus, or fluid drainage, comes about because the leukocytes, is the white blood cells, going out to fight those invaders. And when they fight, they die. And when they die, that's what you see as pus or pus. So once you understand that, you shouldn't have a problem with wounds. You shouldn't have a problem with wounds. Just understand that concept. Remember, nurses all the concept. The body, that is nice big beautiful thing which we call our skin. People talk about skin tones, skin colors, and different things. But all main functions or reason we have the skin is for protection. Because everywhere around us, we have what? Microorganisms. We have microorganisms that is good, and microorganisms that is bad. The bad ones, we call them pathogens, right? So if those pathogens enter your body, they create a problem. Now we know this. But then we also, over the period of time you've been studying, you have realized that to treat, and this is from nursing management, to treat any problem you have in your body, you have to know what? The underlying cause. Same thing goes with the wounds. You're not going to treat a person with a big tissue injury, which is a pressure sore, as if you're going to treat a patient for a stage 2 pressure ulcer. Already about pressure is two different what? A different approach. Right? So you have to know what caused the wounds. That's why you need to put them into these categories. Now, we not only spoke about the wounds, different type of wounds, and touch on the complications. But we want to specifically look at what role you will play. Because that's why you're here, right? What's the role of the nurse with these wounds? And that's called nurse management. And that's when we talking about what? Nurse diagnosis, right? What is your goal? Right? And your goal, how do you want to fulfill this goal? Meaning, what type of treatment? So based on that, you did some treatments, right? You did some research. What's your research, right? That is so based on the nursing research you did, and having spoken, or what the last class you did, was on those different wounds. Do you think, based on what you have read, you could put the wounds to the treatment?
Yes.
So if, I guess you take a little time to do this.
You gotta make a sign.
Yeah.
Okay. You said you know, right? A couple of voices said, yes, we know. So let me ask a question. This is an open question about things on you. Open wound. Means hydro what?
Hydrogel.
Why we don't want to put hydrogel on a wound? Good one. Moist. The people want moist. It will also prevent contamination. Does it prevent contamination?
No.
One hydro just means what?
Water.
That's all hydro means. Water. So what one gel. That's all it's doing. Giving you the moisture. But then we have something that's called calcium.
Arginate.
So what do we use calcium arginate for? What? Very specific. What?
You can use it for like,
Right, all right, guys. Remember when you are doing this research. When you do the research is just like in the Cape Town when you say you're going to implement. Why? So if we're going to say we're going to use original calculus, why? What is the function? How does it work? That's why we just said hydrogel, water, moisture, right? So now using the same technique, can we?
It absorbs heavy exudates. It creates it is indicated for full thickness lines.
One thing you guys should stop it.
Yeah.
It's not heavy.
Did I say heavy? I didn't even just say.
Yeah.
Yeah, I did. It absorbs moderate to heavy exudates. Absorbs it.
His affection is affected the
Moderate. Moderate, right?
yeah.
Okay. What else? How does it work?
It creates it's like protective gel,
Moist gel.
and it comes into contact with the wound exudates.
I don't know, but do you know that sometimes you put certain things inside to make it become jelly?
Yeah.
You add two things together,
Yeah.
but the same action. When the fluid comes in contact with it, it becomes like gelatinous, right? So,
Like for the
right? So that's the action, which is opposite to one which is moisture, and this one is absorbing together. Right. What else did you guys look at?
Dynarex, gauze, transparent dressing.
Why did you use transparent dressing?
It's a film. It's a transparent film.
Right?
like from the germ too. For the germ not to go
Well,
back.
where did we use it?
What do you use it for? IV and
IV lines, but anything else?
physical
It's beneficial. It's beneficial for wound care as well.
But we talked about it.
yeah, it's
IV, right?
All I'm trying to get to you is what type of wound you want to tell me on the line, right? What are the underlying wounds or problems?
physical
You want the necrosis?
minor
Think of it. Why do they set film? And look at the name on that wall. It says what? You God, right? Mean that you can see it. You want to see what's happening under it. And a lot of times you see they use it on people who have fragile skin. People whose skin is about to like be broken. They put it on. And like you guys said, also you put it for people with IVs, because you want to absorb, you don't want to remove the dressing, you want to be there as a protection, but at the same time you want to see what's happening. Okay? What else? What else did you guys?
Iodoform, gauze,
Iodoform.
gauze packing strips.
Packing strips. Why?
Is needed when packing an open wound or draining wound.
So the wound is draining.
Yeah.
And you putting this iodoform. Packing.
Yeah. It's ideal for packing nasal or dental cavities following a surgery as well.
Sometimes in the body, you've heard of fissures? You heard the term fissures before?
Never.
F-I-S-S-U-R-E-S. Like cracks. Please look it up now. Fissures.
Fissures. It's a long, narrow opening or line of breakage made by cracking or splitting, especially in a rock or earth. That's what it is.
What skin fissures now?
Skin
The rock. From the earth into skin fissures. I And when you look for skin fissures, please look for images.
A skin fissure is a cutaneous condition in which there is a
Said it's a cutaneous condition.
Right.
What do you mean by cutaneous, guys?
relating to or affecting the skin.
What? Anytime you hear the word cutaneous,
Skin.
like when you talk about the cuticle, remember the nails is what? And the appendage of the skin. So our cuticles, right? Cutaneous skin. Alright, so just put these things together, that way you're going to remember. Okay?
In which
So look at the fishes. I want you to look at the fishes. I heard you write it just now. But look at the fishes. Look at the skin fishes. Which images?
show me a picture of a skin fissure.
Here are some images of the skin fissure from the web.
So fissures, like you know, have cracks in the ground in the desert.
Yes.
You have some cracks there.
Like a paper cut.
Like a paper cut. It looks like a paper cut.
Right.
But don't confuse it with a paper cut.
But paper cut is quite different from a fissure. Now what you want to ask is the question, what causes skin fissures? Ask the question, what causes skin fissures?
What causes a skin fissure?
This is what I found.
And you'll be surprised.
It's swollen?
The result of very dry skin.
There you go. You see why it is related to rocks in the desert?
Cirrhosis.
Because in the desert, it is very hot, right?
Right.
And the rocks is in the desert. It gets very hot. Then at night, the desert becomes very, very cold. So when it becomes very cold, it cracks. And that's how you get fissures. I believe it, the sands in the desert, all rocks at one time. You crack and break them, crack and break them, crack and break them, that's what's going on. You're hot during the day in the desert, but at night, you'll freeze your butt off. So that is not when it comes to when you think now about your body, and you think about peripheral problems. Why don't you put cold compress on a patient with heart problems? Because it causes peripheral constriction. Knowing the action of hot and cold. Anyway, that's a fissure which is a wound, right? It's a break in the skin. But it comes because of what? What skin condition can bring this about?
Cirrhosis.
Cirrhosis. Persons who are dry, skin very dry. That means they're not having enough water. That leads to the cirrhosis or the fissures.
Dry skin.
So with that right now, with the fissures, you know, you use all these different ointments, right?
Yeah. Lotion and stuff.
Okay. What else have you gone up to now?
What else do we do?
Dermacin.
Dermacin AG gel.
Derma, D-E-R-M-A-S-I-N, right?
Yeah, Dermacin gel.
What is Dermacin all about?
It's an amorphous hydrogel dressing with silver that donates moisture in order to help provide an optimal wound healing environment.
The water-based treat.
Read it back one more time and slowly.
Already. It is an amorphous hydrogel.
A what?
Amorphous hydrogel. Amorphous meaning without a clearly defined shape or form.
Spell it.
AMORPHOUS.
Alright. You know when you say something
Shapeless.
you've heard say something morphs into something? Meaning a person can change. Like you see those monster stories where a guy is Dr. Jekyll, Dr. Hyde or whatever.
Yeah.
A Hulk or somebody. They morph into something. So if you say amorph, you mean without form. Right?
Yeah, okay.
A lot of these words that you come across are from Greek on Latin, and usually comes from their gods and their religious beliefs. Okay? That's what Mark is about. Continue.
The hydrogen provide advanced sewage management and is effective against a broad spectrum of microorganisms. This hydrogen serves as a moist wound healing and support now, as an excellent primary dressing that is gentle for the patient. It facilitates moist wound healing and supports autolytic debridement, while the antimicrobial silver helps to manage the wound bioburdens.
That's a dormicin. It talks about what is inside of it. Look for the word silver nitrate.
Silver, how do you spell nitrate? C-R-A-T-E? Okay.
Silver nitrate dressings.
A colorless solid soluble in water, formerly used in photography.
Silver nitrate dressings.
Dressing.
What are you saying to me? Silver nitrate?
May be used as primary and secondary dressings to manage minimal, moderate, and heavy eczema in acute and chronic wounds, and in burns, surgical wounds, diabetic foot ulcers, pressure ulcers, and leg ulcers.
Right for that?
No, please say that a lot, please.
Because you are engaged with Farrell.
My ear.
Listen.
My ear is there.
Come on, just one more time, guys, listen please.
I'm sorry.
Silver nitrate is in the dormicin also, right? But listen to all the things that silver nitrate do. Sometimes you find them coming in sticks, and they use them to get rid of surgical bumps and weight boards off their finger, really to get these.
Silver dressings.
Silver nitrate dressing?
Yeah. May be used as primary and secondary dressings to manage minimal, moderate, and heavy exudate in acute and chronic wounds, including burns, surgical wounds, diabetic foot ulcers, pressure ulcers, and leg ulcers.
See how many things you can do? Not only does it said what? Acute and chronic. But most of I see them use it is in chronic situations. How do we define chronic? How would we know that the wound is chronic? What would you predict us?
It's been over 8 weeks. I mean, 8 weeks? Is it 8 weeks?
Come on guys, how do we define, we got two definitions. One we got from that hospital, and the other one we got from NCBI, the .gov.
Persistent for a long time. But those are 5 weeks or 5 weeks?
I promise you, you guys are totally out here. Guys,
8 weeks. I said 8 months.
8 weeks.
I said 8 weeks. Oh, I said 8 months.
8 weeks
Confusing.
is what the government says. Right? The NCBI. Until over 8 weeks. But the Cambridge Hospital there was saying that it's between 4 weeks and 12 weeks. So 8 weeks fall in between. That's about the same thing. But you gotta understand what's chronic versus acute. Because the care will be different. With acute, or let me ask you this question. When you look at two wounds, how can you tell which one is acute versus one that's chronic? You look put two wounds side by side, how will you determine which is acute and which is chronic?
How can you, how can you tell that the wound has been to different stages of healing? That's how you know if it's chronic.
You just stand there and looking at it.
Just
You
look at it.
wouldn't know nothing.
No, no.
You see the two
Look
wounds
at
side
it.
by side. So how will you determine which is chronic and which is? According to what?
According to the look of the wound and the stages.
To see if you're healing.
You just look on.
You could look to see like the
Right side.
yeah.
The thing is, with the ulcers it is chronic because they are poor healing. That's why they become chronic.
Chronic.
But what you're going to see? You're going to see fluff.
Black.
You're going to get the exudates
Yeah, the black one.
inside of it. And we'll give you the inflammatory response, right? So you're going to see these things in there. Remember, acute, you don't get infection right away.
No.
Right? The bacteria have to go in and what? They have to kill it. Right? Then it takes a couple of days and then become infected. Right? The incubation period, when they get to become a lot to attack the body, and then the white cells go and then there's where you'll see all the inflammatory response and all kind of stuff. And like I told you guys last day, if you walk and you get a little stick in your foot, right? Something that's sticking, but not very deep. Just feel a little pain. You're like, ouch. And then you continue walking, right? And you forget about it. Until the next day when you get out of bed and you get the throat like, ouch. Why? Because the foot that when you got injected first there were no bacteria to be fighting the white cells or anything going on. It was just a little stick, it takes another. But within that time you go to bed and wake up the next morning, you had a big war going on down here. Like a little stick, but had a big war going on down here. And the outcome of that war was a pain. Which is signs of what? Pain. Alright? Now, when the wound becomes into those chronic stages, we said that usually two things you can look for. One was slough, and the other one was what? Pus? Well, two things they give you, slough,
Color?
when you look at chronic wounds, there's two things you can see. You have slough and you have eschar. Remember, eschar is the darkened black area that covers the wound. Now remember, you cannot stage wounds that have an eschar. When you have an eschar, it is unstageable because you don't know what's going on under it.
Gotta clean it up first.
A slough is that gooky stuff that comes out, the exudate. And you gotta start talking about that before you start talking about what? Debridement. How to get rid of the slough. How to get rid of the exudates.
I confuse the slough with the purulent drainage.
Don't confuse it. What's purulent drainage?
That's the pus. That's the
Exudate, pus, opposite. Actually, look up the word exudate, please.
An exudate is a fluid emitted by
Guys, pay attention, please.
a fluid emitted by an organism through pores or a wound, a process known as exuding or exudation. It is derived from exude to ooze, from the Latin exudare. That's it.
Right. So the fluid that comes out.
Yeah.
Now put in the intake now, purulent exudate.
says pus. It's an exudate, we call it white, yellow or yellow brown.
It was period exudate.
Right, it just says, when I put period, exudate gave me pus.
Right. Because that's what the song you were saying, what mix up between exudate and the pus? Okay.
It's the same thing.
When you have all of this stuff, this goopy stuff, that's where it has a lot of what? Bacteria inside, that's why it has all those fancy colors. Green and yellow. You know, let's put it this way. Now maybe this is going to make you remember these things. When you get a cold, right? You're spitting out and it's white, right? But then after a couple of days, it turns up. Yellow, green, stop making face up like that. It come out from you too. Alright? Yellow and green and all that sort of stuff. Why? When you get a cold, it's a virus. But then now what comes in? Bacteria. And the bacteria gets up in there, and guess who come to fight the bacteria? Because the white blood cells can't fight the virus. The bacteria is there now, because the virus can cause damage, so the bacteria move in. Because the bacteria move in, your what? Your leukocytes come to attack them. And your leukocytes come to fight, and they end up dying, and that's why when you spit, it got a little smell. But when you got them nasty green and yellow and everything, you got a little what? Irritate, right?
Yeah.
Because it's dead stuff. Think of it now with your exudate in your foot and get a wound. When the bacteria go inside there, and now they're going to fight to let out this thing, because the bacteria, once it's open, the bacteria will keep coming. Right? They're going to keep coming. It's like Russia and what? Ukraine, Russia, they just keep going to them all the time. Right? And Ukraine fighting, but they keep coming, right? Same thing. Bacteria keep coming because it's all around. And they're always looking. Remember, like when you think about HIV, right? Remember HIV? Human what? Immunodeficiency virus, right?
Yes.
Now, when you have that virus, it brings down the person's what?
Immune system.
So the body defenses is down. And they said that these persons gotta be protected from
The world.
Yes.
right? Because what we have in our body to protect us, they don't. So now when they get infected, they call it
Opportunistic
opportunistic. The bacteria took the what? The opportunity, because no defense is there.
Right.
Are you guys with me?
Yeah.
So basically that's what's happening to your body. Anytime you got a pin, a prick, a little cut, that's an opportunity the bacteria want. And remember, bacteria are living things. They want to live too. But for them to, they got to multiply, right? And they need the ideal situations to multiply.
Right.
It's like somebody was showing me in the room, one of the things was like that here. See where we call it, border? So the border's off? One of the students was very upset. Because she said, possibly you could be getting out of those things black moths. You know that? The mold? You see, it's a fungus. Some they call moths and all these things. It's fungus. So this mold that she said goes over here, I said you going up to their back. I'm smoking back there. Right? But she has what? A point. And you can't say like, you know, you shouldn't be saying things like that. She has the right to say what she wants to say. But you have to have what? Facts and evidence base. But we do know that these, what, fungus can disappear in your lungs and can cause you to die. when you think about how things are transmitted, think about when you cough, you have what? When you cough,
Sputum.
droplet infections, right? Because that's how they move. When the flowers are doing what? What happens to the flowers? Before they bloom, what do they get?
Incubate, no,
They get pollinated, right?
yeah, pollinated
How do they get pollinated?
from the bee.
The bee, or some of them move with the wind, right? And then there's when a lot of us get what? Allergy.
Allergy. Allergic.
And then you gotta be doing what to your clothes? They tell you now to wash your clothes off and this all stuff when you come into the house because of these pollen. Think of it. These are things that's out there and they're seasonal, just like the flu.
Seasonal allergies.
Right? You have the bacteria around you all the time, but they're different types. Some can come through your nose, some can go through your mouth. The ones we're talking about right now, the one that go through your skin, the wounds. Now, we said the cardboard because it's slough, right? You know what slough is? What's slough? What's slough? What's slough, guys?
Mucus.
Oh, come on, guys. What's slough? Let me take a seat. What's slough? We talked a lot about slough the other day there. Thank you for the conversation about slough. What is slough? The thing is, you gotta know what these things are. Is that what? Slough. What is slough?
It's a mass of the tissue.
The word dead, slough, necrotic. We went through one before nephrititis, fasciitis.
Just say that.
Remember we talked about? And when you said when things dead, it smell?
Yes.
Yeah.
Come on, guys, you gotta remember these things. So slough,
Sarah.
when the wounds in your, where the person got it, start getting this slough inside, it's dead tissue. And you know, for those who've worked in these facilities, that when these people have these ulcers, you smell it. And it smells really bad. But it's supposed to smell bad because
It's dead.
it's dead flesh. It's rotten. And this is where now, because of that slough, if you don't get rid of the slough, the wound is not going to heal. Right, stay with me. If you do not remove the slough, the wound is not going to heal. So how do we remove the slough? Debridement. And so there are 3 types of debridement, right? So what are the 3 types of debridement?
Surgical.
Surgical. And what about, don't move that fast, I'm moving kind of quick. But what happens during the surgical? How do they go about doing the surgical debridement?
They use something to scrape it.
They use something to scrape it.
Like a
But that's the word cut it.
They cut it off.
Insides. So what do they use? They can use a scalpel. They can use a scissors, right? They can use a curette, right? Those are all sharp instruments for cutting. And they can do that. But in the nursing homes, you'll find that if a patient is alert and oriented, because wounds are very painful,
They will send them out to the hospital.
if the patient don't make nothing, don't complain, don't do nothing, don't even know where it's at, you'll find that even the podiatrist when he comes, he's going to be digging up and doing what he's got to do. But once the patient is feeling pain, they usually send them out to where?
Specialist.
The surgical debridement. They don't do anything in the building. Right? But you know, if they're going to send a patient out, it's going to incur what? Expenses. The hospital got to pay. They got to pay for the work. The vehicle that's going to take them there, the ambulance or ambulance, they got to pay for that. They got to pay to have someone go with the patient, the escort. So it's a lot of money. At the same time, they'll be paying a wound care doctor to come every week. So why pay that money to send the patient out when the wound care doctor can do it? Then the wound care doctor will message somebody who's alert because he can what?
So
Feel. It's paining. Stop. What are you doing? And maybe sue them. But when a patient is totally out of it, clip them with cutting, you do all kind of stuff. So that's surgical, right? What's the next one? Enzymatic. And what's enzymes? What's enzymes?
Chemical in the product tissue.
They do what?
It's a chemical agent they use to break down the necrotic tissue.
We used to break down the necrotic tissue. Okay?
Yeah. A chemical. Enzymatic.
So you have these enzyme dressings, right? These creams and these stuff they put inside here. I'll give you guys one last thing. Remember what that one was? Remember the one I gave to you?
With the worms.
No? Enzyme, you have to know one. That was the enzymes.
You talking about the enzyme still? Okay.
Yes. Don't do that.
I thought you said one more. We spoke about two.
I said, no, so tell me some more about it. All right, so you have, I give you the one, the enzyme that I gave you last week was collagenase. And you guys looked it up too, or not? You forget to do it. Lord have mercy.
We just spoke about it with the
Collagenase.
calcium collagen.
Okay?
no, that's different.
Okay. You know the same? Like the calcium collagen?
No, it's
No,
not.
it's totally not.
It's totally different.
Two different, totally different things. All right, and the third was what? What? No. I didn't give you that one again. I give you three of them.
All I know is that you put some one in there and then it's
I gave you mechanical debridement.
mechanical debridement. You whispered it.
Tell me what you said.
You whispered it. He's telling a secret.
Mechanical, and this is one that you will be doing a lot. Because it's a wet to dry dressing. Guys, we talk about this, and I really mentioned to you guys will be doing this one here.
Mechanical.
Because the doctor's going to say wet to dry dressing,
Enzymatic.
and you have to do the dressing.
Mechanical. Automatic. Enzymatic.
And for you who have seen, you've seen when they take off the dressing, what, it adheres to the slough. So when you take out the dressing out, the stick on it, it comes out. But what happens? Now see what? Bleeding. Because they're not just taking the slough is stick onto the healthy tissue. So when you're taking this out now, the healthy tissue has what? Blood vessels. Just going to start bleeding. But the mechanical dressings are the ones that you'll be doing, the wet to dry dressings. And there's usually the normal saline, that's all. Normal saline. And you'll find that for those who have done the dressings and those who have observed the nurses doing the dressing, sometimes they have to pour normal saline on it just to remove the dressing because it's already what? Stick to the point. So you have to wet it, or else if you try to get it up like that, there's going to be a lot of pain and you can get a lot of damage. Right? I'm sure for those who have seen it, who have done it before, You're gonna see, you all see those that all the normal ceiling, that's the cyberware dry dressing. Okay, so you do the agreement, whatever type it is, to promote healing, right? Because if you don't promote healing, the wound is never going to heal. Now we said that you have this exudate. Parts of the slough, you have exudate, right? Pure things come up here. And sometimes it's a lot. So now this is where they're going to get to what? The vacuum, the wound vac. And the wound vac is going to try to absorb all of that.
Moisture.
That exudate.
Exudates.
Right? So absorb it. Because once a wound stays with that necrotic tissue and exudate, it is not going to heal. It is not going to heal. And what else, apart from you doing the dressing, what else, and by the way, nursing diagnoses will be anything dealing with skin impairment or skin integrity impairment, right? What else do you think is required to promote healing?
Protein, the diet,
Diet. So
protein.
you want to have protein diet to promote healing? Absolutely. What else? Position of the patient, because especially if the patient was a pressure ulcer, you want to alleviate pressure. And if it's not a pressure ulcer, you still don't want the patient to be on that risk because it's an injury. Okay? What else do you think you should be doing for that patient?
Depending on the wound, activity as tolerated.
Activity is tolerated? Fantastic. Great. Yes, absolutely. What else?
Change it often.
Train the what?
Clean it.
Why?
So I wouldn't get infected.
That's good. That's
I like to challenge that.
To prevent, I think I know where you're going, to prevent infection. But one of the things you're going to find is you want to talk about the fin just now. Yeah, you usually have it covered and you can see anything that is going on. It depends upon the type of wound that you're talking about. Okay? Where you're going to clean it or you just leave it. You're going to find at times you're going to have one period that they will say leave open.
To air? Right.
You're going to find it's a clean and leave open. Right? So it's got to be depending on what is about the line cause. Alright? Now when you apply wounds, sorry, before we move on, what about equipment? You don't think you have to get specific equipment? Air mattress? We think the air mattress is going to help?
If the client
How is it going to help?
if the client
Do you guys see a lot of air mattresses in use now?
yeah, of course, yeah.
Do you see air mattress or do you see alternating air mattress?
Air mattress, yeah.
An air mattress that's hooked up to no machinery?
It's hooked up to a machine, yes.
That's what I'm trying to tell you guys.
Okay, that's what it's called, an alternating.
Right, because it shifts there. If you just keep, and that was a problem over the many years. We used to give them water mattresses and air mattress. But what happened? You fill up the water mattress with water, and you put the patient on, the space still have the pressure. If it's air, you still have the pressure. It might be soft, it's like you got a hard bed and a soft bed, but you're still getting pressure. And if the patient already broken down, you're not doing anything good for them. So the alternating is that the air goes down and comes up, so the weight keep what? Shifting. Because if you sit down like this, and I can assure you, if you don't move for 15 minutes, you're going to feel it in your butt.
So right now.
If you don't move in 15 minutes, just stay like that, 15 minutes, you're going to feel it in your butt. Because your weight is compressing on those what? Blood vessels. And remember, every time you have blood vessels, blood supply is cut off. Beyond where the blood is going, it's going to be affected. Now, one of the things we kind of focus on also stated that when you have patients with peripheral vascular diseases, be it venous or be it what? Arterial. Because remember they give you those 4 type of,
Peripheral vascular.
you guys remember 4 type of ulcers?
Stage A, stage 1.
No.
Pressure ulcer.
There are the ones that is related to what? Circulatory system. No. The ulcers are related to the circulatory system. Like the ones that is the veins, like in peripheral vascular disease, you'll get what? Venous stasis ulcers. Then you have peripheral artery disease. You have ulcers that affect your arteries. But the one that I'm looking for from you guys to really remember is a neuropathic ulcers. Because in neuropathic ulcers, there's very small skin breaks, but the patient don't know they have it because why?
They don't feel the pain.
No, loss of sensation. And that's why it's all a small something. But because they don't feel
They
it,
don't feel it.
they keep applying what? Pressure. And then what happens? It get worse. It get worse. Until, and you guys saw the cell till you get what? Amputation, they're cut off because it reach a point. If a person have diabetic what? Diabetic peripheral neuropathy. They're feeling, the feeling is lost sensation. Then put on the tight shoes and don't know it's tight. They want to bump their foot and they get a little something and just because they don't feel it, just keep going. And why you think it's going to get worse? It's because the blood flow, peripheral, is not there. The blood flow has been decreased. And when blood flow decreased, it made what? It will take a long time for the vein to heal because it's not receiving enough what? Oxygen or nutrients. On that day also, guys, and we take a whole session talking about this, but you guys have to remember these things, man. You got to put it together, right? Put understanding. Remember also that day we talk about arteries and arterial, and then we talk about veins, and we talk about a specific type of vein that can become ruptured. What vein we were talking about to become ruptured? Come on. What vein were we talking about that can become ruptured? Aortic is not a vein. Aortic is an artery. What vein? Come on. You guys got it there in your head. Come on. That's why I said you don't look at things. You're fighting your brain first to bring it out. That's how you remember things. Your varicose veins. Your varicose veins. You see how tortuous they are? And some people get those things ruptured, they bleed like a pig. Sorry to use that term, but that's a term that people use, so they bleed a lot, to bleed like a pig. They bleed because all that blood is coming out. And we went on to state that where else would you find these varicose veins apart from your legs?
The waist,
The back of
your neck,
There, right here, in the back of the leg.
Your back, your legs, your thighs, everywhere.
everywhere.
Where else would you find them?
Eyes,
On it everywhere.
your eyes,
Where?
And you repeat it.
What's here?
eyes,
Because the Lord says what's here?
Behind it.
and the buttocks.
In the bottom.
What do you mean your buttocks?
Like right here.
Use your terminology. Hemorrhoids are varicose veins. I know you guys are bottom laughing at each other. It's not hemorrhoids are. Look again, because it's just so you guys know. Look at what is a hemorrhoid. Look. What is a hemorrhoid?
A swollen vein, or group of veins in the region of the anus.
A swollen vein. Then if you look and see what's a varicose vein. What's a varicose vein? What's varicose? Look at varicose.
Also known as varicosis, a medical condition in which superficial veins become enlarged and twisted.
Isn't it the same thing?
Yes.
Large vein in the butt, the large vein in the legs, they're still varicosities. But when it's in your butt, they don't call it just varicose veins, they call it
Hemorrhoids.
hemorrhoids. And you have two types of hemorrhoids, internal and external. And there are times when you have what? Bleeding hemorrhoids, when people start bleeding a lot through their butt. So just remember that, guys. Veins associated with ulcers. Arteries associated with ulcers. And the one with biggest culprits is diabetes. Diabetes causes a lot of diabetes causes you to become blind. It messes up your kidneys. It gives you ulcers. You name it, diabetes gives it to you. And the thing is, the diabetes don't come by itself. When you get diabetes, a lot of sugar, right? The insulin not working to make sugar. For what? It's like just like high blood pressure damages your arteries and causes the formation of plaque. Diabetes is the same thing. What's that? They normally come together because think about three that come together. Hyperlipidemia, which is high cholesterol, because now the cholesterol is what? Blocking the lumen. And this is not going to cause the heart to work harder, which means that you send up your blood pressure. And with your diabetes, if you don't use too much sweet, because what's going to happen? You become obese. You will have problems with your circulatory system, right? So that's why the three always come hand in hand. When a person has a high blood pressure, they usually have hyperlipidemia, and they usually also end up with diabetes. Unfortunately. And when we did hypertension, we went through all those different things, right? All those different complications. I keep telling you guys again, when you're reading, focus on complications. Remember, high blood pressure give you complications with your kidneys, cause you to go through dialysis. High blood pressure will cause you to become blind. High blood pressure will cause you to get a stroke. High blood pressure will make you become senile. Dementia, gives you dementia. All of those are complications of high blood pressure. I'm not just saying the patient has high blood pressure. Because most times, patients have essential hypertension, primary, they don't even know they got it. And a lot of times the doctor doesn't even know what caused them to get it. But then when they do the cholesterol levels, to see the cholesterol levels is through the roof. Then we're going to do a stress test. I'm going to do the stress test to see that the heart is not functioning the way it should. They look at the ejection fraction to see how much blood now is leaving the heart. And that's how you want to put it together, right? When you're discussing it. That's why I tell you guys a lot. Discuss. Talk like if you meet somebody in the street, you guys are friends and you haven't met each other for a long time, you chat the same way when you study it. Because this is a very intensive program. You guys have very short time. You need to talk with each other a lot. A lot. You can read a lot, but when you read, it don't mean that you're going to assimilate the information. Right? Assimilating information means that whatever you read, you understood. And you can put it into action. It's not just reading, but reading to understand, and then take what you understand to put it into action. I will read about a gun, right? I read about a gun. I read about different parts of a gun. And if I don't know how to put that gun together, will I ever be able to use that gun? No. I'm not going to be able to use that gun. Same thing when we study it. You can have all the materials, different places, different, but unless you can put it together, you're not going to be able to utilize it. And you want to utilize it when you get to your exams. So again, it's not just about reading, but talking and understanding. Talk with each other. And you guys may think it's crazy when I tell you go talk to your families and talk to people around you. It's because they don't know what you're talking about. Some of them will tell you, shut up now, man, you're talking too much. But the thing is, if they can understand what you're saying, it will mean now that you understood what you're about. And so when you go now to do patient teaching, you know exactly what to say to persons. Because you guys, just remember, communication is an important tool. It says a living, breathing thing. And I'm communicating to you. I'm the sender. Use the receiver. If you don't understand what I'm talking, then there is a problem. And I gotta find where is the problem. Is it when I'm sending, I'm not sending out in the right mode? Or is it that when you're receiving, you are on a different frequency? So you don't understand when I send out. So those are things you have to look at. And I suggest again, do a lot of discussions with whoever, talk a lot. Until you write your exams, talk like you're crazy. I'm serious, talk like you're crazy. Alright, so when you do the dressings now, you guys look at the different type of materials, right? And by the way, put it on top of my desk. Everybody have it for me? On my desk, on my desk, and then I can check it off.
Mercedes is Texas.
Right, and those parts there at the end? Parts of the end. Just the one. I'm still begging. If you guys have any type of expired, I don't want to bring the people stuff from the job and next thing we get into trouble. Anything that's expired that you're going to throw out, bring it, please. Because we're so short of many different things. I'm going to go access them so long as we go. Different sort of stuff, access.
I hate birthdays. I spend all this goddamn money.
All right. One of the things you must understand, and you did your basic microbiology when we talk about what? The pathogens, right? Different kind of diseases and what have you.
Right.
So you must understand what is sterile and what's not sterile. Because if you're going to be doing dressings, you must know when to use sterile equipment and when not to use it. And that knowledge is very important, especially if you're going to be on a unit that they're going to be doing, you have to do the treatment. Now, you're here in nursing, on this nursing program, so you're just doing the basic. But when you're doing wound care, you have so many different types of wound cares. And when you go to work, wherever you're going to be working, if it's specialty unit, you will be what? Trained in that unit. But you got to know what's the basic way of performing dressing for patients. Don't use the word basic again. You start out by looking at what are wounds, and you understand the different type of wounds, closed wounds, open wounds, debridements, and all that sort of nice stuff. Then you looked at the treatments, right? Now you're going to look at the actual performance. How do you know that something is sterile? It is usually in a sealed package. And usually these packets will indicate on it sterile until opened. If you don't see nothing like these on packets, just be careful because it's supposed to indicate it on it. Sterile until opened. I'm going to give your hand some packets out. I don't want you to open as yet. Okay? to look at the package. And look at how a lot of people don't even look at the package when they get it. But look at the package because I know some of you never got dress savings and they're really feeling all with.
I'm tired of one dress.
Me too.
Now this tells you what? The size, right? We already ascertained that it's what? 10 You're going to find that there are packets that will contain the gauze like this. Not.
Yes, okay.
So this here is clean, not sterile. Don't use this to clean the inside of the wound. Do not use this to clean inside the wound. You're going to use this to clean the inside the wound. So guys?
Yes.
Or that steam nurses, take that same one to clean the inside the wound. And you always clean from the inside out. You guys?
Always clean from the inside out.
Always clean the wound
From the inside out.
Never clean. Outside is considered dirty.
Yeah.
Never move from dirty to clean.
No.
It's always clean too.
Clean to dirty.
Alright? Just pass this out. Now, although it is still being used at times,
No, clear
tapes, right? Not used as much anymore. Why not?
Because
Because they found over the years that
it's kills on the
this injuries
kills on the skin. Skin removal.
right, when you're removing it. So what they have done, they have border guard.
There it goes, yeah.
Once it says border, when they're talking about their
Tape.
that's the inside, that's the border. And the gauze is on the inside.
Inside.
So, when you look at this, it says what? 4x4, right?
So that's all glass frames.
So definitely, when you're going to use this, you want to ensure it has the
Same dimension.
size. Because some persons may go and take a 6 and then try this and then they're going to get problems. Alright, so you got to ensure that this is the same thing.
Yep.
Let's try to see. Please don't open up. I'm just passing around. But you're going to do one, which you're going to see is I just pass around and look at just pass it out, just does just a few. Please don't open it. Pass down. When you pass it, finish looking at it, pass it on to somebody else. This is a border gauze, and this is what it looks like. If you've never seen before, please have a look at the border gauze. Compare it to the gauze that you have. Just pass the gauze on. So if you look at me. And now, this is what it looks like when it's open.
That's switch. Right. Just pass it around.
That's the way it's open. Let's pass it down to pass it down.
That's the way to you. That's the way to you, sir. Look at the pressure to this.
Let's pass everything on, except if the first thing. Just pass it around and bring it back to me. Okay, that's what I'm saying. This is to see. What is it? This is see what is that. The only thing you should have with you right now is the balls. Alright?
Pass it down.
This one.
What I do? No, pass it down.
Let's look at it.
Okay.
Bali.
English.
Oh, she doesn't understand
Someone's here.
Now, we talk about the film, right?
The film?
The film. This is a clear plastic. Right? Let's do it.
Got it?
This is how it looks. If you guys have a job, just say bring, please.
That's still a few of
We
them.
have a lot of people who've never seen these things yet.
Yeah, still like a couple of them.
They've never seen.
That's the brown one.
Yeah. Take out the one that looks like a toilet paper, you just roll it out. Yeah. That one.
How well? Just pass it out. Bali.
She said she wants a real cutter.
When you look, you want to just start with the calcium arginate dressing?
Yeah, I know that.
Calcium arginate.
Move this here. Over there.
What you say you do with the calcium arginate? The function?
Sometimes you put honey on it.
I got honey on too, yeah. I got the honey customizing too. Yeah. Grass roots.
You want fabric? You can't sit closer.
Now the card there.
That's the
Gym class, huh?
that's not gym class.
This is toast, she called it.
This one here, some packing. I was talking with some nurses recently, not nurses, sorry, some persons who are in the OR, and they said they usually open it up and hang it, so it takes away smell. It's like an air
It's stuck.
refreshener for the room, then it's stink. Open that, and makes the room smell better than
The rabbit is popping strips.
Now, this is a clear plastic, right? You guys went through and saw it? To pull, to open. Right, see the clear plastic here? When you pull it open, and you pull this at the same time with the two Ds, and comes down there, but it still will have another protection on top. And when you pull, say that you have, sorry, you have this here, right? You see that blue strip?
Yeah, there's another layer
That's another layer that's still there.
on top.
So when you pull this and you put it on, this helps you to put it on. Now, after you put it on,
Yeah, take it
you now will take this.
off.
You see when I
Yeah.
put it together like that? And let's pull it off. And let's have a nice clear so you can see what it is. Okay? Guys, Faith, you think you can do this?
Oh, yeah, piece of cake.
Easy, man. Piece of cake, right?
Piece of cake.
That's good. Piece of cake. Oh, the cake tastes good.
Not that case.
All right.
Oh, now it's funny.
When you see these wrappings,
Finish what I'm talking about.
some of them look like when you do what? Like a boxer, right?
Right, like a boxer.
You take to protect your hands. But why I say a boxer, when you put the bandage on, is because the boxers will start with their finger. Touch it here, then they go to their wrist. So they start at the hand, with your finger here, then they come to the wrist. When you're doing the dressing, or putting on the bandage, sorry, on the hand, you start with the wrist. Okay? And you apply, and you go down. Or you can use a figure of 8. That was down and up, down and up. Complete the bandages. What you're going to attempt, I want you to turn to bandages, bandaging wounds. Turn to bandaging wounds on your laptop.
Look up bandaging wounds.
Apply bandages to the hand. What you're going to do, looking at bandaging the hand, the elbow, the ankle, you name it, but you start off with the hand. Look at how to bandage the hand. Now, where does your hand start from?
Right here. Yeah.
From the wrist, right?
Wrist.
But if you start from the wrist, remember, when you do bandaging of the hand, it is not just the hand sometimes, maybe you have to do the finger.
Yeah.
So you have to know exactly, again, the underlying cause of why you do the bandage. Now, when you're bandaging, these bandages that come in the boxes are not sterile. This
Oh, sorry.
is sterile. Alright. So you'll be utilizing some clean bandages, and I want you guys to clear off.
Okay, with you.
And again, if you got bandages, and when you're clearing off, the person who is applying must be standing. And you may have to remove these bandages. Okay? Then you will have to reuse it.
Bandage somebody can't use a body bandage.
Ready? Yeah. Nice.
Let me see your hand.
You gotta stand up.
Alright, hey, look, don't start yet. Don't start yet. I'm going to tell you guys where to start. And the person who's a patient will be sitting. The other person must be standing.
Okay, no
And you
problem.
will interact with your patient.
Alright.
You will talk to your patient to find out where's the pain.
Okay, bro.
And you're going to explain why you're bandaging.
You gonna say that was okay?
You're going to explain why you're bandaging. You're going to bandage first your hands, so
Okay, no
you
problem.
got to tell them why you're bandaging your hands. And let's go bandage keep your hands just like that. So, look. Sorry. And what you see there?
That's calling now.
Guys, please get off. Let's go to the
I didn't find my beer. Okay, it's here. So we have fractured lung. You fell and twisted your wrist. You fell and twisted your wrist. Right? So why
Come on, man. Come on. Please move. Stop. Go up
damage to the wrist.
Where do I set to do the bandaging? Where are you bandaging?
The hand.
So, is that the hand?
Okay.
It's not okay.
I messed up.
You said you start from the wrist down?
You make 2 initial wraps along the wrist.
And then we go down.
Let me look at me for a moment over here. Look at me, guys. Guys, just look at me. When you got the balls, hold like this. The balls, the roll is in your hand, not downwards. Not down like that. It should be up like this. So when you're going to apply now, it's like, so this is the hand here. This is where you're going to be rolling it around. Okay? You're not going to be coming underneath like that. You'll be putting it on top where you can easily now what? Roll it around. Okay? And it's the hand. And let me see before you unravel, I want to see what it is. Do not unravel until I see what you've done. Come see it. Come see this now. Come see. The palms are not right well. When so high. That's what I said. It's a hand. Alright, guys, just let me just do somebody over here. Come, some, guys, let's just circle around, please. Just come around, let me just quickly do something. Alright? Guys, just come so we not have that problem. Using this thing This is the hand. You start on the inside. One around, two, and then we're going there. Not so much, learning so much, was with racketing, but we're always doing celebration. Now, alright, you squeeze, and look for couple of minutes, okay? This here must be formed. Some persons, when they're doing it, they have a space here. You just learn to wrap. Next you're going to wrap, you do the dressing that I give you. You're going to put the dressing on, and then you're going to do the wrapping. Alright? Like this is a lot. But just continue wrapping and more 2 times. Right. So you can utilize. This here, this one here should be 2 here. Alright, so I got a 2 over here, you would see here that it did not cross over, but it should be 2 here, not 1. Okay? Alright, let's go please. So nothing done. Take it over here.
So we take a, you open it?
Not as yet, I want to see both parts of you.
She had to come
Check around the back.
That's not what it is, it's too loose.
Yes, I know.
So you have to practice it. Come on. What goes around the wrist must be worn in place and covers the entire hand. It's a hand dressing, not a wrist dressing. You go around the wrist twice. This is a facial wrist. Facial wrist. Not around, it's not around the That's not bad. Remember the expression, doing the expression. Mr. West, she did an excellent job. Look at that. Try to do it.
Beautiful. That's good.
That's what you did.
Take this off. This is better. Way better.
Yeah,
You did it so fast, I gotta go to the next station. I gotta get this done.
for me.
Yeah, I gotta get this done. I gotta get this done.
Yeah, because
This is way too high.
let me tell you, take this off and
All right, remember, you also have to check and ensure that it's not too tight. And when it checks it's not too tight, you want to do capillary refill. Okay?
Twice, so we do the rest of this one.
See how this one went around twice, and the rest of it went like this. So about too much love, too much you went around here too many times, you went around here twice, but then focus around the hand, the rest of that. Sounds good. Don't put so much on the wrist. No, you gotta use those things. I told you guys, don't do it. That's the wrong road. You stood in one road right there.
I think that should be
That's too So what's next?
When you have done it and I have seen it, unwrap it and roll it back. Because you will utilize it again. Now what you will be doing next, I want you to open the gauze. I want you to put a little water in it. Alright? Just some water on the gauze. And I ask you to place it now in the palm of your hand. Okay? Wet the gauze. And then you're going to apply dressing. The gauze must be in the palm of your hand. You have a pipe of
Right?
As if you actually have some treatment on it. So you apply the treatment and you do the wet to dry dressing now. I will tell you to do wet to dry dressing, put it on the feet. But I don't want some of you to take off your shoes. Because it will be like my foot. First, so you don't have enough bandages. Some people have bandages you can wear, really appreciate it. That's not.
Wrapping nice and tight. Then we have to I want to do a wet to dry dressing. So this is like you do mechanical reverse neck.
Too tight.
I want to see the wet to dry dressing.
So take it off? So your turn.
Take a picture with this. So remember?
Dry dressing done on you? Please keep it on.
Leave mine on?
Yes, leave it on. Leave it on. I can't leave it on. You guys are fingers, right?
Yeah. You do this stuff.
Everybody needs to have a dressing in their hands. Look at the next. Remember that to dry dressing is like you use it as stellar dressing, right?
Oh, good. Very good. So, like you need to do, on both of us, you're supposed to have it together. So, I don't want it off. I want it to be present. Don't take the dressing.
You said don't take it off.
I don't know why, and guys, now listen, I said do not take the dressings off.
Good hands. Make sure everything's nice and laid. You gotta go over like half an inch over the next layer of the wood, you know? Like regular.
Guys, I want you to keep those dressings on. I want you to move with those dressings and do things. Everybody know if it's really done the right way. If it's slipping off, it's falling apart, then it's no good.
All of these.
No, then look, it's right here, right on, right here.
Where'd you see it?
Only twice, only 2 times.
Pick it up, it's first time. No. Got a 2-minute rule.
Let's keep it on. Alright, let's keep it on, have a seat, keep it on. Please ensure that it's a fix, so it's not going to come off, fall off.
You said something about food. So I'm like, yeah, I got that touch, I got that magic touch. Nice.
Which one of yours is in there?
Oh, Jesus.
Não vai que foto de assim.
Tá legal. Tá boninha. Nice and snug. Like a glove.
check the capillary flow.
We need check for me. We need check for and I use the gloves now. Oh, Jesus. Who did the best? You did this one, right? Okay.
Circle on, because everybody you have one of their hands.
Good, got this good? All right, you got one good? You good over there? All Mr. West is looking now, he wasn't looking before. Can't do it water. You got a bottle with you, we got a whole spring right there.
It's wet here and it was nothing there.
Where you get the water, you ain't going to the same.
Is that the plastic thing?
Yeah, that's the plastic one he took.
I have a doctor's order.
Oh, man.
We don't want no sexual events in here. Make sure you're getting the right order, right treatment and everything.
You don't that book.
You sure the right order? Oh boy, you gotta follow the 8 to 10 ranks. 10 ranks. You ready? Where's your course? Where's the course? I'm trying to steal this one from Mr. Wayne.
Why should children rain?
Why don't we do it?
You gotta pay attention, you know, I have another group, I have 2 other groups. And I know where I'm from, that's why I'm recycling. I'm recycling the No, nobody come and touch my car. I specifically told you, and I've been saying, you guys have listened to what I'm saying. Because I'm doing this with the privates and other students who want to practice school and don't have. That's why I keep begging on that. Everything that I have here is what I'm begging students to bring in. I'm begging you two to bring. I have a class on Wednesday and Thursday, and they will be needing it. So what am I going to use? So that's why I have to do it. All right.
Did a good job.
How do you guys feel with it in your hands right now?
I feel good. I feel very good. Very good, yeah. My circulation
What I want you to do, I don't want you to do no adjustment here. I want you to take out your stethoscope, and I want you to do auscultations on the patient. Okay. One minute to do auscultation on your patient. I don't want you to adjust these things that you got in your hands.
And that's the what?
I'm looking to see if when you applied it, if the person can move their hands. Now we put on bands, you see this? They're doing it, right?
I feel like my circulation is,
The bands you will send with.
I feel like I'm losing my circulation.
Come on, let's do it.
Such a bitch.
Stethoscope on the key.
I'm losing my circulation in this already.
Don't tell me about your stethoscope. That's you come to the microphone every day with stethoscope.
Y'all can borrow mine for $5.
Make it 10.
Come on guys, come on, I want to see the eyes, I want to see what's happening with
You gotta stand up.
Come on, come on.
What's the time on that?
Auscultation of the heart. So when you do auscultation of the heart, you know what you gotta do. That's all I'm saying, do auscultation of the heart. You know what you gotta do, because you practiced it before.
Gotta go skin to skin. What's that?
I didn't want you to do apical pulse, I said do auscultation of the heart. What you listen for,
beats per minute.
Can you give us a lot of beats?
Epical, yes.
My dad?
We're live.
It's only apical, you guys know?
We got an epical, we got a carotid.
No, I'm trying to listen to auscultate. That's using the stethoscope. Are you telling me that it's only apical you know to do at this step one? What lungs have to be the heart? I said cardiac. What are the areas of your chest would you blow for your cardiac?
You have 4. All places love me. All my places worthless.
I'm going to trust you to do it, because if you don't know where those points are at, I just need to repeat what I'm doing. It's not going to ask you unless you know exactly where you put the stethoscope.
Wow.
You said all patience,
All patience, love, me. Wrong. Totally wrong. About you.
no, here. All
You see, there's a thing you guys have this telescope around to try to say that you guys use it to put it on. So you have to put it under your breath. So this is only for those. I'm enjoying that. It ain't working. I'm still getting sick. I tried that and I want to be like this serious with that. I'm serious, you guys need to practice.
Tell me, baby.
You guys remember the line, all patients trust me.
Trust.
But the point is, where do you put the stethoscope? Why am I teaching it? If you don't remember it because we're not practicing. Remember we said it starts in the second intercostal space to the right side.
Right.
Go across to the second intercostal space.
Right.
You do not do the third because the third is an ox point.
Right.
Then you go down to the fourth. And in the fourth, you're going to find the next ball. Your tricuspid. And then you go down to your fifth. And what you going to be picking up now, your mitral valve.
Right.
So why do you guys put it here?
Intercostal, mid-muscular. Come.
All we do is endoscopy.
Oh, then actually, sorry. Yeah. Alright, so you say she want me to take it off. She says I'm right halfway. Let's go. Turn it off. Turn it over. Let's see here.
This is your Dr. Capital? Audio Capital? Go on. Right? And then two.
Wilma? That should be a wave.
Alright guys, so come on, let's go. Chair? We should have two empty chairs in here. I think the one in the front here. Come over here. You listen to those valves. You listen to pick up the valves. Not just doing the apical pulse. The apical pulse is at your fifth in line with big ventricular. Just remember the points. Just like that. You have to know. Well, if that is causing a reaction to you, then you take it off. But the reason why you guys are keeping it on is I want to see one here. That's the effect. And if my movement really does come off, then we will not play.
Mine is secure, right?
Yeah, let's go.
You keep coming and adjusting it. I'm only patient, Mr. West.
Come on, guys. When you finish the heart, then you go to the lung. I want to see that because I can't believe you guys are doing
She's doing it right. She's doing it right. Second intercostal.
You see that thing up there? Guys, you see that skeleton over there?
Yes, sir.
You turn that skeleton and you can see 1, 2. That's how you know the spaces. Not just,
No, it's not good.
get up. And this is the thing properly.
Okay, so, second intercostal. Fifth
Guys, you gotta be more serious.
Fifth intercostal. Right? Which one's the third one? The fourth intercostal? The fourth intercostal, right? So we're only doing them all. We're not just doing that. We're just doing just the heart. The fourth intercostal, right? Right there, a little closer to the nipple. Right there. You go to the number.
All right, you saw here, class B. Everybody please, just a moment. Because we have to say we're sorry. Guys, just a moment, just take it up front here. When we're talking about intercostal space, intercostal space is between your ribs. You have the intercostal muscles. They have to what? Expand the ribs so you can breathe. This is your clavicle. Under your clavicle is one. This is what? Two. Look, 1, 2, 3, 4, 5. So now you're going to space. 1, 2, 3, 4, 5. Right? Toe, guy, your first rib is right up in here. Right up under here. Your second rib is just under it. And just on it, right there, you're going to find your intercostal space. Look at it, and if you don't look at this, then you go over there. You could also see it up there in that diagram. So when you go do, especially doing the midclavicular for your apical pulse, midclavicular, 1, 2, 3, 4. Midclavicular. You guys okay? Just remember your points. You gotta remember your points. It's no good just saying you put it over here, put it over here, put it. You gotta know exactly where you're putting it. Because these are the points also when you're doing EKG. They're going to be putting these things at points, and those are points you're going to remember and know. So it's learning as you go along. Right? Alright guys. Thank you. Let's just continue. Don't adjust. I want to see how those things look in your hands. Come on, continue. And then you do auscultation of the lungs. I want you to try to listen to the lungs.
We're doing the same kind of right? No.
The only thing you do on the other side when it gets into the lungs. The heart is only one here. The heart is only here. Right? This is the left side. The heart is here. Right? Like that. So you listen here. Up here. Then up here, right? So when you listen to the lungs, it's both sides. So if the heart is just here, we don't mind, we don't have to go here. Because over here is where we're going to be finding what? The valve. Right. So second, third is going to be Earth's point. You know when you say Earth's point. You go to your fourth, your fifth. But when you're listening to the lungs now, you start at the back. And you're going in between the scapula. This is the scapula. You don't put it here. See people are pointing here. You don't do that. You gotta come in between. So you gotta feel the person have here. You gotta feel down here. If you come here, listen. That's a bone. That's a bone. You don't want to put it here. Gotta be here. There's nothing. Simply you don't want to put it on top of this. That's a bone. And you gotta go. Now it's when you're gonna do symmetrical. What you were saying you do here and here. And now you do symmetrical into the lungs. What if you do the right side? Go to the left side. Then you go from here, you go from here. I'm listening all the way down. Alright? Just listen to the loops.
Why are you making my son messed up? Look at you. What? You terrible. You're a hater.
I'm healing coffee, that's what I'm doing.
You're a hater. Oh, so you gotta do the back one? So we can't do it in the bone. We gotta do it in the... And nothing, don't have nothing. Are you gonna breathe me and do that? Hold on. Go ahead. Yes, I wanna see if I can. Please. Do it again first. Breathe. Breathe. Which one? Second one. Lay low. Monica.
Guys, it's not just about just practicing the rhythm, but you must know points in the body. So when you do the disease processes, you know exactly where the disease is occurring. Then the first you have a mitral stenosis. You gotta know where the mitral valve is. So it's not just saying, all patients trust me or whatever. You know exactly where it is, but when you enforce it, the way you're doing your pathophysiology. So when they ask you questions and use the pathophysiology, you have a hard understanding. When you listen to the heart, and you listen to the lungs, you listen for what? To see if there are any problems, any disease processes. What is the
Breathe out. Very good. All patients love.
No. Nobody have patients yet. Lungs is just lung.
Breathe in. Breathe out.
And guys, while you're doing the lungs, you must talk to your patient. You must get the patient's instructions.
That's what I did before.
Look at you, you messed up my thing. That's it.
That all your bone box.
I did it, you did it. Here. You have to pay down.
All right, let's have a seat, please. Have a seat.
Yeah, it's yours. That's okay.
No, like in my neck.
Well, guess what?
That's what you like. When they see that,
Guess what, though? She would come in low. She went out to buy a very good one. You know, much more than fancy one pink or something. This is mine. Just tell me this.
All right, how is the baggage in your hands?
Feels good. Still feels good. Very good, yeah. Look what
What I want you to do, I want you to unravel the one, roll it, unravel, roll it as you unravel, roll it together, make it back into a roll.
Oh, shucks. Look at this. I was stuck.
Make it back into a roll.
What you got, the scissors?
That's scissors.
yeah, he's stuck.
On the,
That's exactly what you got.
I got it.
or maybe that will be that scissors.
Cause I did it.
That's right.
Sometimes we're using these things, but unfortunately, surprise.
I went down.
And this is why I beg and this and sign and I'm becoming a first class beggar.
Penhandla.
Nah, I'm no finance.
You know what I mean.
Supplies.
You know what I mean. But when I used to work,
Just put the red gauze you have in your hands, don't throw it out.
let it dry.
Don't throw it out.
Let it dry.
Don't throw it out. Now red gauze you have, put it on the desk in front of you.
Let it dry.
With your hands. Why you make your face up like that?
Oh, it's your body.
You don't know about yours but yours?
It's America. You do what you want.
If any germs is coming, it's coming from you. Not coming from nobody else. So you can't infect yourself like this now. You're good.
You're safe.
So I want you to keep that gauze. Put it right down there. In front of you.
Where's mine?
I have no idea.
You lost the trick on I put in.
Now, okay, take a minute more wiser roll.
I got two. It's gonna take me past the time.
All right, 2 minutes.
Thank you, sir.
Let me open it.
Okay, what are the bones in your hands? What's the name of the bones in your hands?
Carpals, metacarpals, phalanges, tarsals. No tarsals. No tarsals. No tarsals.
Bones being broken in your hands. Or you could have situations where somebody get shot in the hands, or have defensive wounds, especially knife attacks and what have you. Defensive wounds, right? Put your hands up and you get caught. Sometimes when persons are playing sports, they will break a finger, right? Or they may have a sprain. And you guys remember what sprain is, right? Now what I want you to do now After you finish rolling, I want you to apply a bandage on, not on, let me put, apply a splint to your right, most of you right-handed,
Show me a picture of
to
the
your left middle finger, without using any foreign material.
I didn't get that.
You said right.
Middle finger. Just only. Apply the splint to your right middle finger.
right shoe. Show me a picture of a splint.
You out in the field by yourself, you are in Ukraine, and you got an injury, so you gotta take care of yourself. So let me see you put one for yourself, to your right middle finger. Yeah. No, it's if you're right-handed, you will do to your left. If you're left-handed, you do to your right. So it depends on which is the dominant hand. Wherever is the dominant hand, you use the other hand. And when you finish, show me your handiwork.
Only your middle finger?
Apply that splint to your middle finger.
That's a lot.
Just show me what you do.
So dude do Shama Holler, my girl. I got her phone, right? I got her phone, so she got my phone. I'm good, so I got a lie, but she was a reference letter, right? So he helped her. I found out.
How?
Because she already told me about it.
That's your handiwork.
I was just like that. She get caught up. She gets caught. That's it. Just be really good at what she do. Don't get caught. She get caught.
I see one, two.
I'm not encouraging it.
Where is this finish?
You know what I mean?
People say it's too much.
You know what I mean? I'm not encouraging it, but it's one of the teeth with the best teeth. They're not going to get caught.
He's still mad?
Of course. I'm doing my perfectly.
So she told you about him, so she already told you about him, so there's nothing wrong here.
Exactly.
Okay. Are you good?
But of course I'm good. I'm not good. I'm just honest.
You delete all your stuff.
I'm not honest. I'm not good. Listen, I'm not good. I limit the truth. I don't say the whole truth.
All right, guys. Let me see what you have. All right, take a little stop. A little bit please. What did I ask you to do?
Apply.
Put a splint to your middle finger.
Apply a splint to your middle finger.
To your right hand.
To the hand that's opposite to your dominant hand. The right, then do to the left.
Okay.
None of you did it right. Everything was wrong. Right, but apply a splint to your middle finger. Right?
That's my middle finger.
Apply a splint. So you know what a splint?
Yes.
You use one finger to support the other finger. This is your middle finger. Use this finger to support it. Come on, guys. That's for sake. So for people know that. Normally, do you see people using a metal, a ceramic to put it over there? Right? But you don't have that. You just have a bandage. So what do you do?
Use the other finger.
To split.
Right hand.
So just like when you do your NCLEX, you give out a
Bless you.
Alright. So try it. Either use it as your index finger or the top finger to split. And you can still, why are you doing that?
I talk to them, but I don't know.
You just watch yourself and you don't know what to help you.
I don't think you're further than that.
And you don't spin that finger, start that fingers spinning like crazy. So you do some forcing to yourself. You don't want that to have to become
I don't
damaged.
trust nobody.
You want to keep that finger, so you have to stabilize the finger. So stabilize the finger.
Oh, this one is too tight.
When you wrap the finger by itself, it's if you're going to do dressing for a cut or something on the finger, but not a split.
So tight.
You split to it.
Yeah, it's tight as hell.
You sprint it. Now after you sprint, just show me how you sprint.
I don't know.
Alright, now that unravel that good, change your roll.
I feel like she is because
Unravel to your roll.
accusing me with shit.
This is good, Mr. Lewis.
And you just might really do something
Once you understand the concept, is what? Using one finger to stabilize the finger that is injured.
I'm not gonna perfect.
Okay? Using a good finger to stabilize the finger that is injured. That sounds good. Not at all. This normally they will give you what? One of those metal things?
Yeah.
And you put on it, or you take two popsicle stick.
Yeah.
I put the two popsicle stick
And
and then wrap around the popsicle stick. You use the two sticks as your split. When you don't have that, this is emergency. So like you might think you gotta get to the hospital or something, because that's all you do. For a finger, that's all you do. Right. Now, unravel, I'm going to go to the next steps. Can you quickly guys? Round B. Big man, tired. Big man need to sleep.
Tired too.
All day from 4 o'clock this morning before 4 o'clock I get up.
So 6 a.m. I've been awake.
That's I go all the way up by, what's his name? By Sodium. All the way up there I have to go.
So I had to go down the block to the corner store. Never asked what.
The college with the students. That's us. All the way up, you know, my kids. It's a long drive.
Doing good.
You're so lazy.
Doing good. Proud of you.
It's just like,
That's what I do. Good job. Good job.
no, they called me.
Let me fold this one too.
You can do better. Hurry up.
All right.
Anything else?
This is what you're gonna do now. Remember that piece of gauze you had? That thing right over there? I want you to take that gauze and put it between your fingers like that. What? In between your fingers.
Oh, goodness.
So let us look on the two
I just said this every day. You come out and talk to me. I didn't know what she like.
There's two pieces. Put it between the finger here, one between the finger here.
Fuck my whole shit. I'm not gonna lie, fuck that.
Right. Put it between your fingers. Put it between your fingers. So you got it between here, then come here, then that will come here and go here. And then when you have it, now I want you to apply.
He's so secret. I don't know if
It's actually,
You will apply the dressing with the pieces in, no, I'm not so big.
You said 2 fingers or 3 fingers?
Take
We're gonna put it between all the fingers.
Oh. All your fingers, including your thumb.
Your fingers, not your tongue.
All your fingers excluding your thumb.
Then you come over here and do this other two. The one there is a little short, like that's a bit longer. And then come around and do, like they come up to this one here. And now you're gonna wrap. Now if you have money to put, but let's suffice with that. Alright? If you open it up, you find you got two dogs.
Let's see what he did over here.
Now you have two.
What did he do?
Now, look at the video of how to
Look at the video of
don't jump serious. Our flying our finger with the CD with our hand. All the fingers. You know, you apply it. You're not going to wrap on like that. I'm going to show you how you apply it to fingers. Wrong.
So you want us to do, we have to put this on the finger? You gotta open it up. You gotta open it up. You gotta go like that. Like that. Gotcha. Well, can you see a YouTube video real quick on the board?
How you apply to those fingers with the bandage in here.
Gotcha.
Okay, now look at the video. Now we gotta be somewhat handy.
This. Go around. Come back around. This one. Wrap it around like that.
I wanted to show you three different fingers.
Okay.
You want to separate. Where the fingers separate fingers. Apply bandage, separated fingers. You don't want the fingers to be together. That's why you put a band. Is that how you ladies all do your what? Your toenails. Don't they put something between?
Yeah.
So it's the same concept. You put something in between to prevent the fingers from being together. And then now you're going to apply, okay, good. Now you're going to apply.
Like that?
Right? And you...
Like what?
Video show you different techniques.
Who got it right?
I got it right.
Oh, you got it right?
I don't know, you tell me.
I thought somebody just got it right.
You have different ways of applying that. Remember, the concept is to keep the fingers what? Separated.
Okay, so I got my right there. I'm good then.
When you apply the bandage, I'm not just not going to... Right. Take a good look at the video. You're going to see different types.
I don't need no video. Look at my hair. I'm doing my right. So you do it.
Different.
Look at the video. I'm telling you. Why is it never asked you to look at the video?
That's the one.
So we can remember.
Using an opportunity to assimilate and look at
Got it?
Have you seen something? I'm practicing at the same time.
What are we searching on
So
YouTube?
you are by yourself at home?
Merla. Can I see that too? I want to see that too. It don't matter. Do it. Do like that. I want to see it too.
Make sure you hold the top, the bottom bit. Just twiddle the top.
Oh, nice.
Through. If you keep in hold of the top and the bottom.
Oh, nice.
And then twiddle it a couple of times.
That's some new stuff. That's some new stuff.
And twist it. You didn't do it.
No. But that's why we guys have an idea.
That's cool. I like that.
Let's understand that those are different ways of doing different type of what?
Dressings.
To the hand.
Separate the fingers.
Not dressing only for one finger. You have to dressing for that separately.
This is tight, my lord.
And you do it to yourself. As you're doing it to somebody else, you might have it much more. Softer, right?
Yeah. I don't know why it feels so tight though. Now loosen it up a little bit.
Now you may have situations where the wound is at, and when I use the word wound, they don't mean knife, gun, chopping, or these things, violent stuff. You can get incisions from doctors and what have you. Like you could have an IUD, right? Irrigation and drainage, and then you have an abscess. And you have to apply apply the dressing and hold it with bandages. Because most times you use the bandages in the hand with wounds is to hold the dressing in place. Okay? And that's why I wanted you guys to move around and do different things with the hands, just to see how it will be held in place. And it will be a learning experience for you. And knowing that when you put on dressings, that persons are active, persons will be moving around. And it could lose out and be non-effective. Also, you want to maintain the principles of that you must put your fingers in between to ensure that you're not creating a what? A constriction on the concussion, on the hand, and you also want to test using what? The pupillary refill. Okay? So that's a pupillary? Capillary refill. Nobody corrected me. Just make me talking over some nonsense. Capillary refill. Capillary refill, right?
Idiots.
You may have also, guys, stay with me, for you who could get bandages, get your husband, the children, and not just the hands, but try, especially with kids, ankles. Try stabilizing ankles. But most times in this modern age, we don't use bandages to stabilize ankles. We go to directory and buy one of them ankle guard, right?
Yes, sir.
And that stabilizes it. But when you have cuts and bruises and decubitus ulcers, you have to apply what? Dressings. And if you have to apply dressings, you must know how to bandage the ankles without doing it too tight that you cut off circulation. You may also have to apply for wounds to the popliteal area. Where's the popliteal area? Behind your knees. You may have to apply bandages so you can maintain the dressing in that area. You may have stab wounds. You also like to show those movies and man get hit in his head and they put on bandages. They have caps and the bandages help to support also.
That's good.
Please understand the underlying cause and why we do dressings. Please understand infection control.
Very important.
Please understand infection control. And you started today, and don't do like what you showed me today. What you showed me today was that you guys didn't do practice nothing related to auscultation. That when we do it one day, that's it. We move on. You gotta go back. Everything that you do in this classroom is supposed to be going back and practice. But it's not just practicing how to do it. Just remember, when you go to the state boards, it's not a practical session, but the understanding of why you do it and how it's going to help in pathophysiological situations. Anything else? You could be in emergency situations with patients. Family members or friends may see you and, they want you to help. You can do something. And also, I want to leave with you guys today that every system that has some kind of pathophysiological problem, you must look at the complications. Everything you do, please look at complications. Now what is CML? What's CML and CML and AML? What's that? What is CML, AML?
CML.
The names in my blood.
Blood rest from KCL, guys. After today, I started TV, where mine was saying that you have to take this medication that they're advertising. Right away, you guys should be telling me what? Leukemia. Right away, you guys should be jumping at me and saying, oh, leukemia. Those are the types of leukemias. Lymphocytic.
Acute myelocytic
We did this.
leukemia.
We did leukemia, so we did this, and we went through tuberculosis, which is more acute,
Chronic
prevalent in older people, all that sort of stuff. But you guys gotta try to read up, man. Don't listen to it fast. What's FSH?
Follicular stimulating hormone.
Good. FSH, follicular stimulating hormones. And where will I find the corpus luteum?
In your brain.
Where will I find corpus luteum?
When the egg is after
Corpus luteum.
Fallopian tube? No? Okay. Over?
when the egg is
Come on, Sandra.
Oh, it's a hormone.
it's an ovary. It's a word to find. It's inside the uterus.
You see what I'm trying to say, guys? Foods, majority, nourishing, and easy so that we live in all days. Corpus luteum is what remains after the Graafian Falcon has released the
What is the separation in the brain? What is that?
It's a system.
It's a lutein something now. Now?
No. No.
What is it called?
I don't know what you're talking about. I don't know what you're running the brain. I'm serious, I don't know what it is.
Alright, I'll find it.
Right? The one that we're talking about is what?
Corpus luteum.
And what I want, why I ask these questions is to what? Stimulating back into
To remember.
to get it. Not to get it. And you forget it.
Back up. Okay, come back.
And why I'm talking about these, because we're talking about hormones, right? Because when there is a graphic culture, you have to have what? Estrogen. And then the corpus luteum to maintain, because the egg, as we call it, becomes implanted in your, then you need progesterone to maintain it. And you guys know that there's 3 sections for your fallopian tube. We went through all of that. You know, each section has a part to play. And why, at that time we said why persons were, why it's high risk for certain persons to have ectopic pregnancy.
Keep trying.
Because the egg, the egg is fertilized by the sperm in the fallopian tube. We do maternity nursing rather soon. So please brush up on back in maternity nursing so that these things that you did before as your anatomy physiology, now we do the disease read up on the female reproductive system. Right, female and male, because you gotta know about the testosterone too, and the different glands that are involved. Because of these different glands and secretions, you will be talking about the different diseases. You must know the female reproductive system, so when we're talking about the uterus being a problem, or if it's the cervix being a problem, or the vaginal canal being a problem, fallopian tubes, or is it the ovaries? All have different problems, and we have to touch them. And to make more sense if you understand, have some knowledge, or remember some of the basic anatomy physiology. It's going to help you a lot when we start talking about these disease conditions. Okay? Guys, I put these up here. Took my sweet time to put them up here. When you come, look at them, they're large and nice. Look, you have the female down there. I have the male. They can even break up the fallopian tubes for you. And then you have the endometrium in your cervix, in your uterus. What causes the contractions and all that sort of stuff. All these nice stuff. The reproductive system is down to the end.
Implanted.
That's 2 side by side, so when you look at it, you don't kill yourself also, just learn it. Alright? Alright guys, there's nothing else, thank you.